Making every contact count, or MEC, is an approach to behaviour change that utilises the millions of day-to-day interactions that organisations and individuals have with other people to support them in making positive changes to their physical and mental health and well-being. The NHS 5-year forward view calls for a radical upgrade in ill health prevention and public health promotion. And the current expectation is that staff across all NHS organisations, including ambulance services, will utilise MEC in their daily interactions with patients. The Association of Ambulance Chief Executives has recently signed a commitment with partner organisations to proactively support this area of public health promotion across the UK. This short film is a simple introduction for all ambulance staff to highlight the fundamental idea underpinning the MEC approach. It's not about adding another job to already busy workloads or telling people what to do or how to live their lives, but it's about having that quick, simple conversation about how somebody might improve their health and well-being and signposting them in the right direction.
The MEC approach can be applied in your interactions with work colleagues, family and friends, as much as with patients. And the messages may also be relevant to yourself when thinking about your own health and well-being. You'll learn more about MEC throughout your training and experience, but it's important that you know about support services in your area and direct referral pathways available to your trust, so that you can readily signpost people in the right direction.
That's it.
Interventions targeting at-risk drinkers and specialist treatment for those with harmful drinking patterns are effective ways to reduce consumption and harm.
You drink alcohol, Wayne?
Yes.
You had any alcohol today?
The ambulance service are in a unique position because it's a teachable moment. It's a moment for them to sort of offer some advice around the risk of drinking. It's an opportunity, so it's an opportunity moment as well. If you can educate somebody and send that educational message across, even in a 5-10 minute brief chat, then I think that's a brilliant way forward in terms of somebody then thinking about what they want to do moving forward if they feel actually I have got a problem.
We've got various referrals in place within the service. A lot of patients are not really interested, but this gentleman was interested in the referral, and because of that you feel as though you've got an opportunity to change somebody's life, and as the referral's gone along, that's happened. From memory, it was up to 2 to 3 bottles of brandy a day, which is obviously quite an excess. And from my understanding now from the referral, it's now looking around about 6 units a week. So it's quite a dramatic drop in his intake of alcohol.
Right, step this way.
Sit.
Chris's referral to a local alcohol recovery service has been successful for his patient.
As an ambulance service, we're here to preserve life, and if we can preserve another person's life, even one person from a referral, then do it. We've got to do it. It can make all the difference to somebody.
Explain to a patient the consequences of their drinking, the steps they can take to reduce their consumption of alcohol. Be aware of referral pathways available in your area. You can try broaching the subject with phrases like, "Can we discuss how much you're drinking each day? How do you think your drinking may be affecting your health? Would you like us to have a think about what support could be available to you?"
Hello, we've called for an ambulance. Hello, my name's Sarah. This is Dan. Who have we come to see?
My husband John.
Whereabouts is John?
He's had a fall in the back.
Okay.
Thank you.
Hello, John.
Hello.
Hello, my name's Sarah. This is Dan. We're from the ambulance service. What's happened, John? How did you end up down here?
I was going along, and normally I'm all right walking anywhere, but I caught my foot
and went over like this.
During any attendance in a patient's home, ambulance personnel are well positioned to identify those who may be at risk of slips, trips and falls.
What medical problems have you got normally, John?
Pointing out tripping hazards and giving advice on falls risks may reduce the likelihood of these types of incidents. If appropriate, consider referral to the local falls intervention team.
Obviously, in terms of falling over in the future, we want to try and prevent that as much as we can.
Yes.
Obviously, as you get older, unfortunately, people fall over a lot more. So we just need to be aware of things around the house, such as the wire from the fan, that can obviously act as a trip hazard, or for any of us, really. Your rug is lovely, and sometimes people trip over the edge of them, so that's just something to sort of bear in mind.
I see.
And then what we want to do before we leave is refer you. We have a falls team that we can refer you to, and they will make contact with you and have a chat about falling and how you can prevent falling more and keeping active, and perhaps giving you some exercises to help keep you nice and strong to try and prevent falls. They sometimes come around and do a little assessment at home and have a look at sort of how you live in environment, if there's any hazards that they need or any bars that they can put up, a stick that might help you. I realise you'll tell me that's for an old person. So we've got a curry leaflets around with us from Age UK about strength and steady. So are you happy for me to leave this with you, just have a look at your leisure? But it tells you about ways to keep yourself fit and active and help prevent falling over. And some things about worrying about falling. Because once people fall, they often feel a little bit more anxious about falling again. The other thing you perhaps think about, John, is that you can have a pendant, an alarm pendant.
I've heard of them.
Okay, so they're quite handy, especially if you're here alone and your wife's gone out and you were to fall over. If you fell over where you were, you wouldn't be able to get to the phone.
No.
So what you can do is then press this alarm and it goes through a control room and they speak to you through what seems like magic, but it's through a speaker, really. Okay.
Oh, that's good. Thank you. Well, you've been very helpful.
Encourage people to stay active, eat well and reduce alcohol. Discuss other ways how a person can cut their risk of falls. Find practical solutions to prevent falls if these are obvious in the home. Ask older people in contact with health services whether they've fallen in the last year. A referral to a falls intervention team may be needed.
Thank you.
The ambulance service undertakes millions of journeys each year, many of which are discharges from hospital or visits to outpatients appointments. These are prime opportunities for staff to make every contact count. Look out for evidence of loneliness or social isolation. For example, is the house cold?
This is my favourite spot.
It's quite cold as well, isn't it?
I'm right, I keep my jacket on and then if I get really cold I just put the blankets round myself and I'm sorted then.
Do you live alone then, Mr. Stanley?
Well, I live with my wife, but I suppose I did. I do miss the Mr. Wife.
You don't have no one that comes to help you at home?
No.
Do you? No. And how well do you get around the house? Heater needs to come on.
I use my trolley if I need it.
Yeah.
But for the most part, I keep hold of the walls and I go upstairs when I go to bed. And
you've never had anyone come and help you with anything?
I've not really felt I've needed it, really.
Would you be happy if we referred you to a team to have some help at home for you?
But I'm quite happy.
They're not going to do no. They're not going to do anything you don't want to do.
I'm worried about them, what they might do. And
they won't affect you in any way, and what they'll do and see if they could help you in any way. Yeah?
Is he all right, Mr. Stanley?
Yeah, he's all right, yeah.
I live next door here and I'm really worried about him. He seems really lonely since his wife died and he seems to be forgetting things.
Be aware if your patient is forgetting and repeating things. Lonely and isolated people are at increased risk of developing dementia. Look and listen for signs.
Thank you. Thank you.
Things to consider. Can they meet their basic human needs? Can they access the toilet? Can they make a hot drink? Do they have friends or family visit them? Can they keep warm? Patients may be wary of accepting help due to a fear of losing their independence. Make a safeguarding referral if necessary, or discuss with your line manager if you're unsure. Consider signposting to helplines like Silverline or Age UK. Be aware of other local voluntary sector support groups. Be aware of direct referral pathways in your area. .5 million people in England smoke, but 2/3 say they want to quit. A patient has called 999 with breathing difficulties after a severe coughing fit.
Okay. Do you smoke?
Yes, I do. Usually a few throughout the day, but especially like at work when I'm very stressed out.
Okay, well, you do know that smoking could be one of the reasons you're feeling so breathless. Have you thought about stopping at all?
I have, but I don't seem able to stick at it.
Okay, so what sort of support have you had?
Nothing really. I've just like cold turkey, just been trying to do it on my own. But I've been smoking for so long, I don't suppose there's any point in trying to stop now.
Okay, well, you know, it's never too late to stop smoking. You know that you're up to 4 times more likely to stop if you get some professional support. Something like your local stop smoking service or your surgery or even a local pharmacy could help you with that and give you some details. I'd also advise that you see your GP about your cough, especially if you've had it more than 3 weeks, because it could be a sign of lung disease or even cancer. It's probably nothing serious, but you do know that finding it early does make it more treatable.
Ask. Assess current and past smoking behaviour. Advise. Provide information on consequences of smoking and smoking cessation. Act. Provide options for later, additional support such as a GP appointment, local stop smoking service or a community pharmacy.
Hello sir. My name's Tom, I'm one of the paramedics.
Okay.
What's your name?
Chris.
Hello Chris, what's the problem today?
Just had a bad asthma attack.
Okay.
Although called to an asthma attack, the patient presents with several comorbidities, including type 2 diabetes and atrial fibrillation, as well as being overweight.
We know that physical activity has a really positive impact on people's health, and becoming more physically active at any stage of life can have health benefits, and those health benefits can be physical but also emotional as well, so it's a really important way of safeguarding our emotional well-being. We know that physical activity can help prevent a number of clinical conditions, and that includes a lot of the common cancers. It includes diabetes, chronic respiratory diseases and cardiovascular disease, and many more as well. In addition to helping prevent those conditions, for people that already have those conditions, it can help improve treatment outcomes, and it can really help to limit the impact that those conditions have on people's everyday lives.
Lovely, thank you Chris. So your blood pressure is ever so slightly high, Chris. It's about 150/90. It's not scary high, but it's a little bit higher than we would like of someone of your age. So it could be due to your weight. If you're slightly overweight, it could be due to your level of exercise. It could be down to your diet, things like the amount of salt that you have in your diet. Do you do much exercise?
Walk down to the pub occasionally.
Yeah.
Ambulance staff are in a very privileged position in that they have many contacts with members of the public every single day, and many of those people will be inactive and will benefit from becoming more active. So I'd really encourage ambulance staff to take those opportunities and to raise the conversation with people when it's appropriate, and just to engage them in a conversation about how they might be able to become more physically active.
Okay. So it may be that you need to make some little changes in conjunction with your doctor, things that maybe try and do a little bit more exercise, sort of 20-30 minutes of walking every day.
It's thought that if we deliver brief interventions for physical activity to patients, then we can expect that for every 12 patients we deliver that intervention to, we could expect one to become more active. So we could expect one of those patients to move from a risk category of being inactive to being out of that risk category and being physically active and meeting the 150-minute target.
And if you reduce a bit of weight, then it will bring your blood pressure down and reduce the risks of that.
Okay.
All right?
Yes, fine.
These kind of messages can apply to all of us when thinking about our fitness.
In terms of the current physical activity guidelines, the magic number is 150 minutes of moderate intensity physical activity built up over a week, so 150 minutes over a week-long period. And when we talk about moderate intensity physical activity, we're really talking about getting a bit warm, getting a little bit out of breath, but the general rule of thumb is that you would be able to talk, but you might not be able to sing, for example. So that's a useful guideline to pass on to patients.
Recommend healthy lifestyle changes which can make all the difference. Less salt in the diet can lower blood pressure. Online meal planners can help improve eating habits. Remain physically active for at least 150 minutes a week. Start slowly and build up. Just 10 minutes at a time can make a difference. Mental health problems affect 1 in 4 of us, yet people are still afraid to talk about it. Research from the Mind charity shows members of the emergency services are even more at risk of experiencing a mental health problem than the general population.
Mental health is probably one of those unspoken elements that ambulance service, or actually emergency services, experience throughout our structure of work. We see a lot of patients with mental health without a shadow of a doubt, but actually do we recognise and do we do anything about it ourselves? I think once you've sort of got some buy-in that your colleague, your friend, your peer has sort of recognised themselves as well, that they might be having a bit of a difficult time, it's about making sure that you have the confidence to know who you can refer them to. There are huge support networks about there that are actually in the UK. There's Mind's Blue Light programme, there are Samaritans. Sometimes it's something that's happened and that's maybe a significant time ago. Certainly some of the big incidents that have happened in London or in any part of the UK, you don't probably recognise and reflect on that for some time.
Excuse me, please don't lecture.
Or until you go to or experience something similar and it triggers. So it may have been 5 years ago, 10 years ago, but something will just elicit that response. And when that comes back, it's, okay, I didn't deal with that, or I should have said something, or actually maybe there wasn't anything available at that time. Maybe it was swept under the carpet. Maybe there was the rough and tough, okay, just deal with it and get on with it. As an organisation that wears a uniform, it's not a suit of armour that protects us. We have emotions and we need sometimes to be protected and supported through those emotions.
Someone may be in need of professional help if you notice significant or unexpected changes in behaviour, mood or how they interact, eating habits or appetite, increased smoking or drinking, interest in activities or tasks they had previously enjoyed, how they reach or make decisions, their work output, motivation levels and focus. Do not fear asking, "How are you?" Let them know you're there if and when they're ready to talk. Show your support. Maintain your own mental well-being. Listen, give space to allow your colleague to talk freely. Stay calm. Remember, you're not there to provide answers. Encourage them to seek help. Many long-term conditions are closely linked to known behavioural risk factors. Making changes such as stopping smoking, improving diet, increasing physical activity, and reducing alcohol consumption can help to reduce the risk of poor health significantly.
That's it.
Remember, MEC is a simple approach to promoting behavioural changes and encouraging people to seek preventative help that utilises the millions of day-to-day interactions we have, whatever our role is within the ambulance service.
Woke up early one morning.
Think about how you can apply MEC whilst at work with patients and colleagues, as well as with friends and family. Consider how these messages may also apply to you in maintaining your own health and well-being.